Irrigating and cleaning a stoma. For this procedure you will need a colostomy irrigation kit, a stoma dressing, clean gloves, an IV pole, and a bedpan, toilet, or basin. As you walk in, provide for privacy. Greet the client and verify his identity. Explain the procedure. Wash your hands and don clean gloves. Assemble the irrigation kit by attaching the cone or catheter to the irrigation bag tubing. Fill the irrigation bag with 1,000 cc's of tepid tap water. The use of sterile normal saline is not necessary. Hang the bottom of the irrigation bag at the height of the client's shoulder or 18 inches above the stoma if the client is supine. Open the clamp and let the water from the irrigation bag fill the tubing to eliminate air bubbles that can cause cramping. Check the direction of the intestine prior to the irrigation of the colostomy by inserting a gloved finger into the orifice of the stoma. Measure and cut the ostomy wafer so that it fits over the stoma. Place the irrigation sleeve over the stoma and attach it to the wafer. Cuff the end of the irrigation sleeve and place it into the toilet bowl or into the bedpan. Lubricate the cone end of the irrigation tubing so it will not cause trauma to the intestinal lumen. Insert it into the orifice of the stoma through the top opening of the irrigation sleeve. Close the top of the irrigation sleeve over the tubing to prevent the water and stool from splashing. Slowly run water through the tubing and into the colon. If cramping should start, immediately stop and allow the client to rest for a few minutes. Remove the cone after all the water has emptied out of the irrigation bag. Close the top end of the irrigation sleeve. If the client is able to walk, clamp the bottom of the irrigation sleeve and encourage ambulation to help move the remaining stool from the colon. Remove the irrigation sleeve after 20 to 30 minutes or when the stool is no longer emptying from the colon. Cleanse the stoma and skin with warm tap water and gently pat dry. Place a stoma dressing over the stoma to absorb any mucus. Dispose of used materials in the appropriate container. Finish by removing your gloves and washing your hands. Then document the procedure.